Some apps under fire accused of promoting plastic surgery and very unrealistic standards of beauty to children. This is where I go off limits with this. With more, Dr. Richard Chaffoo, you know, you got to think about this, not even for the older kids who have their own phones, but the little kids who have access to all this stuff nowadays.
They do, Shally. I have 6 kids, you know, ranging from 20
Hold on, wait a
to
minute,
3
you have
years
6
of age.
kids?
I do. And I'll see, you know, the younger kids, my younger twins will be playing with one of the devices or phones for my older child. So it's really important, this issue about these apps and trying to, in some way, monitor what's going on with these kids.
Let's talk about these particular apps. What kind of message? What is the app about? What are kids getting their hands on?
So I actually looked at these apps myself. I was
Okay.
playing with them earlier today, and they're disturbing from a number of different perspectives. One is, I think that they sort of trivialize surgery, and they make it sound like it's something, you know, minor. I think it can also be frightening, Shally, for kids. You know, some kids, obviously kids have to go to the doctors for their vaccinations. Some unfortunately have to have a procedure or go to a hospital. It can create a phobia or a fear of doctors. And the other issue is, of course, today with all the social media influencers talking about plastic surgery procedures, it's something that, this is not something that we want kids to be involved with. Obviously, body image is very important, and I don't think these apps really have any place in kids' lives at this point.
Dr. Chaffoo, you say kids live. I'm like watching this off the corner of my eye on these monitors. Who would want to play with these? Look, this is really graphic.
Very graphic, yes, very disturbing.
And people play with these
Well,
games?
apparently some do, but you know, as I went on the app, there were these little banners and pop-ups from other companies that were going through, so it may actually also be a channel to sell products. So
Oh, man. Okay, but obviously somebody created this. Is there a need for this? Like,
Well, to answer the question, Shally, we do use technology in plastic surgery. So if a patient comes in to see me and they're concerned about their nose, we can use computer imaging for simulation. But again, these are for adults. These are not for children. And while there is places for plastic surgery, more reconstructive in you know, younger people, craniofacial surgery, there's serious surgery that's done. We do surgery on younger people sometimes, you know, pin the ears back, otoplasties or rhinoplasty for a teen, but this is really going beyond that. This is looking at very, very young children, targeting them for elective procedures.
Because, you know, when you do, like, because we've done many segments with you, you know, about plastic surgery and whatnot, those are legitimate medical photos that, you know, people want to look at. What we just witnessed looks like a cartoon. So it looks like it's targeted to the kids.
It is.
When you really notice what's happening, what that was, I don't got to get that image out of my head now.
I know. And it's the image is also about, you know, self-image. We want our kids to grow up with a good self-image and body image. We don't want them to be overly concerned about their appearance. We want them to be able to put that in perspective when they become adults.
All right, Dr. Chaffoo, thank you for being here. Good warning
here.
for the parents. Let's talk later, another day. Let's do a whole segment about you having 6 kids.
Okay.
Because that's a lot. That's a lot of kids. All right, it's 9:17. Let's get you over to Christine.